So you've mentioned the surface of the cornea and how it's minimally invasive, this laser. Could you just expand on that? It is minimally invasive. What benefits would our patients get from that?
Okay, well, you're correct in that term, minimally invasive. I mean, there's been comparisons made to sort of keyhole surgery, what people describe this type of surgery that is increasingly being moved to have less invasive forms of surgery everywhere in the body. And although the eye is a small organ within the body, this effectively is again that drive to affect the cornea to the least degree, and therefore preserve the different components of the cornea, and to minimally affect them, but still produce the change in shape, and therefore the refractive change, and therefore the loss or the reduction or loss, complete loss of the requirement for spectacles or contact lenses. Now, the key benefits that you've asked me to describe are that the structural integrity of the cornea is less effective, and therefore it's stronger. Secondly, so that's a biomechanical strength aspect of the cornea. But where it really comes into its own is that most people, and to this day still most people in the UK and Ireland, in their laser are treated through a treatment called LASIK. And LASIK really implies that there's a shape change occurs underneath a flap which you've created. And that flap which you've created, in doing so, you reduce the strength of the cornea, but probably more important than that, you have a flap which, until that flap is really healed down strongly, it's possible to move that flap. And therefore, for people who practice sport, particularly contact sports, one really has to be very careful in these situations. And they, post-surgery, should they have that, if they were, say, a boxer or someone who it's very likely to be hit in the eye, it's important that if they had LASIK, that they would leave it for a long period of time, and that would be months really before going back to contact sport. A surface laser is a laser which predated LASIK slightly, but it has remained with us and been used, and it's pretty much called either PRK or LASIK. That's with an EK, LASEK. And these are terms which are abbreviations for a lot of words really, but effectively what they mean is that you're lasering on the very surface of the cornea, and therefore you go through the surface epithelium, or some might describe it as the skin of the cornea. And the difficulty with that is that the recovery from that then is delayed. It's really very painful, but the beauty is that it is again biomechanically stronger. Again, the difficulty here though for patients is that few patients like to suffer a lot of pain. They want, because they've been used to having LASIK with quick recovery, again they want a quick recovery, back to work, back to function. But the LASIK flap poses difficulties for sportsmen and sportswomen. That's one major advantage therefore with SMILE. The other advantage of SMILE is that because the treatment doesn't affect the nerves to the same degree, it doesn't therefore, and it doesn't create the flap, and therefore the surface, or with the PRK, it doesn't actually laser right down through the surface. So the whole tear film complexed with the underlying epithelium, or as we described as the skin of the eye, is very little affected. And particularly with female patients, the incidence of dry eye increases with age, and any laser surgery can induce, in a few cases, an increase in dry eye problems. With SMILE, you have a much reduced impact upon that tear film, and certainly in our own work in this clinic over the past years that we've had this, 4 to 5 years, we have very carefully assessed the impact upon the tear film and compared and contrasted that with our LASIK patients, and we see a great difference, a large difference between them, and a great improvement in the tear film in our SMILE patients compared to our LASIKs. And this again is corroborated with other published similar results from other groups from around the world. So it's not something that we're getting that isn't being repeated in other centres in the world. We're finding very similar results to what they are finding. So I think what we can draw from that, when we find that these results are being shown in different countries and different institutes, and they agree with ours, it gives us great confidence in the use of this laser, and the confidence to be able to tell our patients, look, the chances of developing any significant dry eye post the SMILE laser surgery is much reduced than if you were having LASIK.